Beauty scientists Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
The other issue is in terms of communicating, because I think when you have a problem and there are a couple ways to fix it, well, that's actually weird in medicine. Most of medicine is very algorithmic driven. Like, you have pneumonia, we're going to fix it. That's not true in plastic surgery, where you have a problem. Well, there are a couple ways to fix it, and none of them is better or worse. It just depends on your situation and surgical preference. So if you could expound upon that, as well as the ethical dilemmas regarding that.
Yes. And so that's part of the conversation when patients come in. It's like, look, there's women coming in for breast rejuvenation after having kids. And it's like, well, first off, we got to get in your head. Do we want the breasts, do you want them bigger, smaller, lifted? Do we like the shape we have and just want to change volume? Are we really trying to adjust that? So there's so many things that we can do. And, I think thankfully, most of our patients are very, very reasonable. They want natural results, things that make sense. Ethical considerations, if someone comes in, they're like, I want to have breast implants so large that I fall over, then, I have to explain to them why I can't do that for them. It's one, it's, first do no harm as a physician, and rarely, but sometimes we end up in situations like that where we have to explain what is possible, at least at this time in medicine, both from a anatomical perspective and then also just from functional perspective, like what we can do. And just because we can do something doesn't mean we should do it. That's a Dr. Roarkism as well. So sometimes those are difficult conversations because patients may not understand initially why that is, but I spend a lot of time with them just to make sure that they understand that I want to give them what they want, but it has to fall in that realm of what is possible and safe. So within that, we'll hone in on the specific look that they're going for, but that's also something that should be comforting in a way to them, is that I'm not going to let them do something that doesn't make sense.
Yes, I totally agree. And I do think the plastic surgeons are better at communicating. Even if you're at a university setting, you're in a group, it's all reconstructive. We have to be able to communicate to patients what's possible and what's not, and really meet what they're envisioning in their brain and expectations and what we can deliver.
Yeah.
Yeah.
And the starting point is so important. Everyone's anatomy is different. Everyone's starting point is different. Our tissue qualities are different. Age can be different. Just your frame or your figure, your facial anatomy. So that is why every consultation is unique. And you can't just come in with a picture of supermodel and be like that, because we want to choose a body type that's similar to yours. And some people we can create more of an hourglass. Some people are straighter, but it's about adjusting what we're starting with.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.